Have you ever wondered why Tadalafil gives you excellent results one day and seems to do almost nothing the next? You follow the same steps, take the pill at the same time, and yet your body responds unpredictably. That inconsistency can create frustration and doubt, especially when confidence matters the most. I am Dr. Jennifer, and in this video, I will explain the exact medical reasons behind this problem and the proven strategies that help men achieve strong, consistent, and lasting erections every single time. The way you take Tadalafil determines how well it works for you. Many men unknowingly make small mistakes that weaken its effectiveness, while others learn to use it in a way that supports their bodies' natural rhythm and delivers powerful, reliable results. Stay with me until the end, because I will show you the science, the timing, and the correct approach that separate disappointment from true confidence. By understanding how your body processes Tadalafil, you will finally be able to use it correctly and experience the performance you have always wanted. I will address 3 common myths about Tadalafil, explain why each is false, and give a concise medical reason you can use today. Myth 1: Tadalafil works instantly. Tadalafil may begin to appear in the bloodstream quickly, yet the majority of men reach an effective response only after a delay. Clinical reviews report that some men show an effect within 15 to 30 minutes, yet most men require up to 2 hours for reliable response. Rushing to judge effectiveness within minutes creates performance anxiety that interferes with results. Myth 2: one failed dose means the drug is ineffective for you. A single poor response often reflects timing, anxiety, food, alcohol, or individual absorption differences, not drug failure. Early failures are common. Clinical guidance recommends several supervised attempts under low pressure before concluding the medication is ineffective. Your nervous system influences local blood flow through adrenaline-driven vasoconstriction, which opposes the drug action. Do not judge the treatment on 1 or 2 experiences. Myth 3: all generics perform the same. Regulatory agencies evaluate bioequivalence, yet formulation and manufacturing quality influence absorption profiles, especially time to peak concentration. Well-regulated generics match the reference product within accepted limits, yet not all sources use the same quality controls. For reliable, repeatable results, obtain medication from reputable manufacturers or a licensed pharmacy and review bioequivalence data where available. Those 3 clarifications matter because they change how you approach treatment. Timing matters, repetition matters, and product quality matters. Follow these principles and you will avoid common mistakes that lead many men to abandon an effective therapy. Let us look at what science actually says about Tadalafil and why understanding its pharmacology completely changes your results. Clinical research shows that Tadalafil has an average half-life of around 17.5 hours, which means that even after a full day, about half of the drug still remains active in your bloodstream. Because of this long half-life, Tadalafil can last up to 36 hours in the body, which is why it is often called the weekend pill. This does not mean you will experience constant arousal during that time, but that your body remains ready to respond naturally to stimulation for more than a day after a single dose. Now, what truly determines consistent performance is plasma concentration, the steady amount of medication circulating in your blood. When that concentration stays stable, your results become predictable. However, missing doses, eating heavy meals before taking it, or combining it with alcohol can create fluctuations that reduce effectiveness. A structured dosing routine helps maintain this balance. According to a study published in the Journal of Sexual Medicine, 78% of men who followed a consistent dosage schedule achieved reliable results within 6 weeks. In contrast, those who used Tadalafil irregularly showed much lower response rates. This means the key is not only taking Tadalafil, it is how and when you take it. By respecting the 24-hour cycle of your body and maintaining a consistent level in your bloodstream, you transform the medication from a temporary fix into a long-term, confidence-building solution. I always remind my patients that Tadalafil works best when body and the mind are aligned with a steady rhythm, and science supports that entirely. Now let us understand what actually happens inside your body when you take Tadalafil. Tadalafil belongs to a group of medications known as PDE5 inhibitors, short for phosphodiesterase type 5 inhibitors. To put it simply, this drug helps your blood vessels relax by increasing the effects of nitric oxide, a natural chemical your body releases when you are aroused. Nitric oxide signals the muscles in the blood vessel walls of the penis to relax, allowing blood to flow in more freely and create the pressure needed for a firm erection. Normally, an enzyme called PDE5 breaks down a substance called cGMP, which is responsible for keeping the blood vessels relaxed. When Tadalafil blocks PDE5, it allows cGMP to remain active longer, meaning better blood flow and a stronger, longer-lasting erection. In response to stimulation, after you take the tablet, it begins to absorb through your digestive system, typically reaching effective levels in about 30 minutes to 2 hours, depending on your metabolism, whether you have eaten, and your body's individual rate of absorption. That is why timing matters. A heavy meal or high-fat foods can delay the absorption, while consistent, predictable use helps the body respond more efficiently. But biology alone is not the full story. Anxiety and adrenaline play a much larger role than most people realize. When you are anxious, your body releases stress hormones like adrenaline, which causes vasoconstriction, a tightening of blood vessels throughout the body, including those in the penis. This reaction directly opposes what Tadalafil is trying to achieve. In other words, even if the medication is active in your system, tension, fear of failure, or performance anxiety can override its effects by reducing blood flow where it is needed most. That is why I always remind my patients that sexual performance is both biological and psychological. Tadalafil supports your body's physical response, but true confidence and consistency come when your mind is calm and your body is allowed to cooperate naturally. Understanding this connection helps you use the medication as part of a holistic approach, one that supports both your physical readiness and your emotional balance. Now that you understand how Tadalafil works and why consistency matters, let us talk about how to apply this knowledge in real life. There are two main approaches I recommend, depending on your lifestyle and goals: the always ready approach and the on-demand approach. There are two main ways to use Tadalafil effectively depending on your lifestyle and goals. Always ready daily 5 mg dose. This low-dose daily method keeps a steady level of Tadalafil in your bloodstream, giving you natural readiness anytime without planning. Pros: steady confidence, reduced anxiety, spontaneous intimacy. Cons: daily cost, requires routine use. Best for men in stable relationships who want consistent performance. 2. On-demand 10-20 mg single dose. Taken 30-60 minutes before activity, this method provides flexibility and control. The effect lasts up to 36 hours. Pros: cost-efficient, long duration, situational control. Cons: timing pressure, variable results after heavy meals. Best for men who prefer occasional or planned intimacy. Avoid splitting unscored pills, watch for mild side effects, and consult your doctor before changing doses. Above all, remember Tadalafil works best when your mind and body are in sync. Consistency, calmness, and confidence are the real keys to success. Many patients ask whether both methods, daily and on-demand, can be combined. The answer is yes, but only under professional supervision. You should never exceed 20 mg within a 24-hour period. For example, if you are on a daily 5 mg routine, adding an extra dose must be discussed with your doctor to avoid excessive buildup in the bloodstream. Safety and stability always come first. Another advanced concept is minimum effective dose testing. Every man's metabolism and sensitivity are different. Some achieve excellent results at just 5 milligrams, while others may need 10 or 20 milligrams for full effect. Finding your ideal dose involves gradual, supervised adjustments starting low and observing your response over several weeks. This approach minimizes side effects while maximizing results. Lastly, let us touch on bioavailability differences between reputable and non-reputable generics. All approved generics must meet basic bioequivalence standards, but not all are manufactured under the same quality controls. Differences in fillers, coatings, or tablet compression can slightly change how your body absorbs the medication. Always choose trusted, pharmacy-verified brands to ensure stable absorption and reliable results. So, what have we learned today? Success with Tadalafil depends on timing, patience, consistency, and the right dosage strategy. Whether you prefer the daily approach for continuous readiness or the on-demand method for flexibility, the real secret is understanding your body and using the medication wisely. Now that you know how to use Tadalafil correctly, you hold the key to confidence, control, and lasting performance. Take a moment to reflect on which approach best fits your lifestyle, and I would love to hear your thoughts. Share your experiences in the comments to help others learn from your journey, and subscribe for more expert-guided health insights with me, Dr. Jennifer.